In a previous video, we talked about different classes of drugs: depressants, stimulants, hallucinogens, and opiates. But there are other ways that we can categorize drugs as well. Another way that we could classify drugs would be by their risk, by their potential for addiction. And I think we all naturally have ideas about which drugs are more dangerous than others. And one popular way to think about this is in terms of hard drugs, or drugs that have high addiction potential, and softer substances, which are seen as less dangerous. But there must be a way to quantify this somehow, a way to evaluate drugs for risks separate from public opinion. And that's what I want to talk about in this video. The first example about how we can do this, how we can try to distinguish between drugs to figure out which one is the most dangerous, is according to the guidelines of the FDA, the Food and Drug Administration of the US. And they divided substances into 5 different categories based on their abuse potential, by their risks of physical and psychological dependence, as well as asking if the substance has an accepted medical purpose. And we refer to this method of classification as the Schedule of Controlled Substances. And each of the 5 categories is a different schedule. Schedule 1 drugs are drugs that the FDA has determined have a high abuse potential and also have no accepted medical use. And this includes heroin, LSD, THC or marijuana, mescaline, and MDMA or ecstasy. And these drugs are illegal. A doctor cannot generally prescribe them for you, and researchers have to jump through a lot of hoops in order to get them if they want to study them. Schedule 2 drugs are drugs with a high potential for abuse that have some accepted medical uses. And this would include opium, morphine, cocaine, and other drugs within the opiate class. It also includes some prescription drugs like Demerol and some amphetamines, including Ritalin, which is prescribed for ADD. And so some, but certainly not all of these drugs, can be made available with a prescription. Schedule 3 drugs are drugs that have a moderate abuse potential, less than those in Schedule 1 or 2. And they also have some accepted medical uses. And this category includes ketamine, as well as a bunch of anabolic steroids and a number of barbiturates and benzodiazepines. Schedule 4 drugs are drugs that have a low potential for abuse and also have accepted medical uses. And this schedule also includes a number of barbiturates and benzodiazepines, things like Xanax and Valium, as well as some opiates like Tramadol. Schedule 5 drugs are drugs that have the lowest potential for abuse and are available with a prescription. And this schedule includes things like cough suppressants, which can contain a limited amount of other scheduled substances, like cough suppressants that might contain small amounts of codeine. And I want to point out a few things about this schedule of drugs. First, this rating system pertains to the US, and it does not necessarily line up with how other governments in other countries have categorized substances. Second, this rating list was created in 1970, and it is admittedly old and somewhat slow to change. But it has been amended several times, and it will continue to be amended in the future. And lastly, I want to point out what is missing from this list: alcohol, caffeine, and tobacco. And the reason is that these drugs are not considered to be controlled substances. These drugs are legal, although it is true that for alcohol and tobacco there are laws regulating use for minors. But because these drugs are legal and because they're not prescribed by doctors or really thought about in any kind of medical context, they are not included in this rating system. But this is not the only way that we can sort drugs by abuse potential. Another way was created by Dr. Henningfield and Dr. Benowitz, 2 scientists who study addiction. And they rated substances along 5 continuum. Number 1, whether or not they have withdrawal symptoms, and if they do, how severe they are. 2, how strongly the use of the drug is reinforced. 3, the level of tolerance that the drug produces. 4 is the level of dependence, so how difficult it would be to quit, how many users are dependent, and how many people relapse. And 5, the level of intoxication produced by that drug. And so the scientists looked at a number of drugs, and they rated them on a scale of 1 to 6, with 1 being a stronger level, and 6 being the least. And so I have a chart here with the mean scores of each drug, as rated by each scientist, as well as a column here for a combined mean score. And the first thing that I want to point out when we look at this chart is that both researchers were pretty much in agreement with each other, although they did disagree in some circumstances. And another thing that we see when we look at this combined mean column is that heroin was rated the most dangerous drug, And of course, this fits with our cultural narrative of heroin being a hard drug. But note that heroin is followed by alcohol. And this is something that I think is important to consider, because alcohol is a drug. It is a drug that is legal and readily available, but it is a drug nonetheless. But even though the scale takes into account 5 very important aspects of harms that can be caused by drugs, there are some problems with it. One problem is that it ignores long-term health consequences. So lung damage from smoking nicotine and marijuana wouldn't be reflected here. But that seems like a really important thing to consider when trying to figure out which drugs are the most dangerous. Also, this rating scale doesn't take any social consequences into account. It says nothing about financial loss and family struggles. And even though these things are separate from risks like tolerance and withdrawal symptoms, it seems like something that we really shouldn't ignore when considering which drugs are the most dangerous. And to take these things into account, we can look at yet another rating scale. And this scale was created by addiction researcher Dr. David Nutt. And he and a team of researchers rated drugs along 2 main criteria: harm done to the user and harm done to those around them. And that would include family and friends as well as society as a whole. And within these 2 general categories, he further separated criteria based on physical, psychological, and social harms. We have physical harm done to the user, and that could include a risk of overdose or injury or other bodily damage that might occur when someone is taking a substance. Psychological damage to the user would include things like dependence, and also takes note of how drugs can impair mental functions. And social harms to the user would include things like a loss of relationships with family and friends, as well as things like losing a job or other financial difficulties. In terms of harm done to others, we have physical and psychological harm, which have been lumped into one group. And that could include things like domestic violence, or bystanders that are involved in traffic accidents. And then we have social harms to others, and that includes a whole number of things, like crime or damage done to the environment from the manufacture of that substance. And I've made a graph here for us to examine the results. And I included all of the drugs that they talked about in their study, in case you want to pause the video and take a closer look, but I'm just going to focus on the results for a few of them. So I'm just going to point out a few specific things. First, you will notice that alcohol is rated as the most harmful drug by far, and that this is followed by heroin, crack, and meth. But let's look at this graph a different way. Let's look at it in terms of the breakdown of harm to users and harm to others. And when we do this, we get a slightly different picture, because we see that a good portion of the damage caused by alcohol is harm to others. And I don't know how clear it is here because I don't have world's greatest drawing skills, but I can tell you that heroin, crack, and meth lead the way in terms of harm done to the individual. Although alcohol still comes in fourth, so it isn't exactly out of the running. And I think that this scale is really unique in that it allows us to consider things like social and financial factors. But like all of the scales we've talked about, it also has some shortcomings. For example, this rating scale doesn't differentiate between legal and illegal substances. It also doesn't take social norms into account. If you were to meet up with friends at a bar to drink after work, most people wouldn't find that abnormal or wrong. But they might have a different opinion if you were to meet up with friends after work to use heroin. And so if you can, take a moment to think about the effects of legal status and social standing on this rating scale, and how that might affect where things appear on this graph. Another thing to consider are the criteria for this rating scale. We can calculate things like physical harm based on drug safety ratios. So the ratio of a normal dose of a drug to how much is needed to overdose. And we can measure that really accurately depending on someone's weight and gender and blood alcohol level. But unfortunately, as of right now, we don't have an objective way of measuring social harms. We don't have an equation that we can use to calculate it. And the researchers who came up with the scale did use things like police reports and crime records when determining social harms. But maybe we will have to wait for the next rating scale to find a better way to quantify this. Another thing that we should keep in mind is that the scale doesn't differentiate by amount of use. So we see that heroin is rated as very dangerous and that mushrooms are rated pretty low in harm. But what if someone were to use them every day or multiple times a day over a long period of time? How do you think that the amount of use should fit in with our understanding of the dangers of drugs? So we talked about 3 different rating scales in this video. 3 different ways to try to assess the dangers of different substances. And I really wanted to highlight multiple strategies to show you that this is a complicated question, and that there really is no set answer to it. But one thing I think that you can take away from all of these different rating scales is that even if some substances have a higher risk than others, there is still a risk that is associated with all of them. And that's something that's worth paying attention to.